Good morning, Mrs. Lee. I understand you've been experiencing some abdominal pain. Can you describe your symptoms?
梗係可以。我右上腹有好劇烈嘅痛，特別係食完油膩嘅食物之後，有時個痛會傳到背部同右邊膊頭。
Have you experienced nausea, vomiting, or any changes in your bowel movements?
有，我成日覺得好反胃，有時仲會有吐。最近我發現大便顏色比平時淺色咗。
Do you notice you have jaundice?
咩意思？
Jaundice is a condition where your skin and the whites of your eyes turn yellow. It happens when there's too much bilirubin, a yellow pigment, in your bloodstream. This can occur if a gallstone blocks the bile duct, preventing bile from draining properly from the liver.
冇，我冇發現皮膚或者眼白變黃，但我發現尿液比平時深色咗。
These symptoms suggest a possible issue with your gallbladder. Have you had any imaging studies done, such as an ultrasound or CT scan?
有，我嘅家庭醫生幫我安排咗腹部超聲波檢查，佢哋話我有膽石。
Let me take a look at your chart. Gallstones can block the bile ducts and cause inflammation, a condition known as cholecystitis. This can lead to severe pain and digestive issues. The most effective treatment for symptomatic gallstones is a cholecystectomy, which is the surgical removal of the gallbladder.
手術係唔係唯一嘅選擇？有冇藥物可以溶解膽石？
While there are some medications, they work slowly and are only effective for small cholesterol-based stones. However, they don't prevent new stones from forming.
我可唔可以試你啱啱講嗰隻藥？對我有冇效？如果我唔切除膽囊會點樣？
Your stone is not small, cholesterol-based gallstones. You have multiple pigment stones and calcified stones. Medication alone is unlikely to provide lasting relief. That's why cholecystectomy is usually the recommended treatment for symptomatic gallstones. If left untreated, gallstones can cause repeated episodes of biliary colic, acute cholecystitis, or even gallstone pancreatitis if a stone blocks the pancreatic duct.
我需要做咩類型嘅手術？
We typically perform a laparoscopic cholecystectomy, which is minimally invasive. It involves making small incisions and using a camera to guide the removal of the gallbladder. It is so much better than open surgery. It results in less post-operative pain, shorter hospital stays, quicker recovery, and minimal scarring compared to an open cholecystectomy.
點解我唔可以只做膽石清除手術？點解要切除成個膽囊？
Gallstones tend to recur even if we remove them. The gallbladder itself may not function properly anymore, leading to continued issues like inflammation or bile duct obstruction. Removing the entire gallbladder prevents future complications and ensures that the problem doesn't come back.
冇咗膽囊會唔會影響將來嘅生活？
Most people can live a normal life without a gallbladder. Your liver will still produce bile, but instead of being stored in the gallbladder, it will flow directly into your small intestine. Some people may experience mild digestive changes, like occasional diarrhea, especially after eating fatty foods. However, your body usually adapts over time, and most patients don't have long-term issues.
冇咗膽囊之後，我需唔需要跟住特定嘅飲食？
There isn't a strict diet you must follow, but you may need to make some adjustments, especially in the first few weeks after surgery. Since bile will flow directly into your small intestine without being stored, your body may have a harder time digesting fatty, greasy, or fried foods. I recommend starting with a low-fat diet, eating smaller, more frequent meals, and gradually reintroducing foods to see how your body reacts. Most people adapt over time and can eat a normal diet without major restrictions.
如果我將來懷孕，呢個手術會唔會有影響？
No, but pregnancy can sometimes increase the risk of gallstone formation due to hormonal changes. Since your gallbladder is removed, that won't be a concern.
膽石會唔會遺傳？
Yes, genetics can play a role in the development of gallstones. If you have a family history of gallstones, you may have a higher risk of developing them. Other risk factors include obesity, a high-fat diet, rapid weight loss, certain medical conditions like diabetes, and hormonal factors such as pregnancy or hormone therapy. While genetics can increase your risk, lifestyle choices also play a significant role in gallstone formation.
我將來嘅小朋友有幾大機會會有膽石？我係唔係應該唔要小朋友？
While genetics can increase the risk of gallstones, it does not guarantee that your child will develop them. Other factors, such as diet, lifestyle, and overall health, play a much bigger role. Pregnancy itself can increase the risk of gallstones due to hormonal changes, but it is not a reason to avoid having children. If you are concerned, maintaining a healthy diet, staying active, and managing weight can help reduce the risk for both you and your future child.
呢個手術有冇風險或者併發症？
As with any surgery, there are risks, including bleeding, infection, injury to the bile duct, or bile leak. In rare cases, a patient may develop post-cholecystectomy syndrome, causing persistent digestive issues.
乜嘢係膽汁滲漏？
A bile leak occurs if bile spills from the cystic duct stump or bile ducts after surgery. It can cause abdominal pain, fever, and require additional intervention.
手術大概需要幾耐？
A laparoscopic cholecystectomy usually takes about 45 minutes to an hour. However, if complications arise, it may take longer.
係唔係全身麻醉？
Yes, you'll be under general anesthesia, meaning you will be completely unconscious during the procedure.
我要住院幾耐？
Most patients go home the same day, but if we need to perform an open cholecystectomy, you may need to stay for 1 or 2 nights.
係咩原因會導致膽石？
Gallstones form when there is an imbalance in the substances that make up bile, such as cholesterol, bile salts, and bilirubin. This can cause bile to become oversaturated, leading to crystal formation, which eventually turns into stones. Common risk factors include a high-fat, high cholesterol diet, obesity, rapid weight loss, diabetes, pregnancy, hormonal changes, and family history. Certain medications and a long-term low-fiber diet can also increase the risk of developing gallstones.
可唔可以用激光打碎膽石？點解唔可以用呢個方法？
Unfortunately, laser treatment is not an effective method for breaking down gallstones. Unlike kidney stones, which can sometimes be broken up using shockwave lithotripsy, gallstones are different because they form in the gallbladder, where they can easily recur. Even if we could break them down, the fragments might still block the bile ducts, leading to complications. That's why removing the gallbladder is the best long-term solution for preventing future problems.
我呢個情況有幾緊急？我要幾快做手術？係咪一定要即刻切除膽囊？
If you're only experiencing mild symptoms occasionally, the surgery may not need to be done immediately, but I wouldn't recommend delaying it for too long. Gallstones can suddenly lead to acute cholecystitis or bile duct obstruction, which can make the situation much more serious. If you're already having persistent abdominal pain, fever, nausea, vomiting, or even jaundice, then you may need urgent treatment and possibly immediate surgery. So, I recommend scheduling the procedure as soon as possible to prevent complications.
我唔想再拖，盡快做手術。呢個手術安唔安全？
A laparoscopic cholecystectomy is a very common and generally safe procedure. The risk of major complications is low, especially when performed by an experienced surgeon. However, as I mentioned earlier, as with any surgery, there are some risks, including bleeding, infection, injury to the bile duct, or bile leakage. Serious complications are rare, and most patients recover without issues. We will take all necessary precautions to ensure the safest outcome for you.
我哋幾時可以安排手術？
We can schedule it within the next week or two, depending on availability. I'll have my staff coordinate with you.
多謝醫生。